Good morning, Law Offices of Stephen Weir. My name is Ashley. Today we have Dr. Amber Nixon from Healing Peak Regenerative Medicine here today to talk about what she does at her clinic and how she treats acute and chronic pain. So Dr. Amber, it's up to you.
Thank you. Right, hi guys, I'm excited to be here. Thank you for showing up. It's a beautiful day, and so thank you for sitting in here with me. Here we go. I'm a naturopathic doctor. Do you guys know what a naturopathic doctor is? Have you ever? A little bit, okay. So I have a Bachelor's in Science in Nutrition and Food Science, and then I have a Master's in Chinese Herbal Medicine and Acupuncture, and a doctorate in naturopathic medicine. Naturopathic medicine is very similar in education to regular medical doctor training. We just look at the body a little bit differently. Our philosophy on treatment is different, but all our basic sciences are the same. We have board exams just like MDs do. We have prescriptive rights in Washington. So naturopathic medicine is just really about the philosophy versus ND versus MD, and they all have their place. I also have extensive postdoctorate training in injection therapy, and that's really what I do the most and what I love to do is use needles to help get rid of pain, which sounds counterintuitive, but it's not. And by the end of this, you'll get it. So how the naturopathic medicine philosophy works is that we're looking to really find the root cause of pain, figure out, where is that pain coming from, what is involved in it, from internal causes to, trauma or injury. And so the thing that we do is try to figure out the cause, and then we treat that cause, and then that eliminates the pain, and that patient isn't dealing with chronic pain forever and ever and ever in the pain management model. So we're trying to eliminate and restore the body's process. I take a holistic approach to pain. That's kind of what I just said. So the therapies that I use are acupuncture, trigger point injections, prolotherapy, and platelet-rich plasma injections. And I'm going to go through each one of these separately. And sometimes I do a combination of the above. And after I'm done, there'll be time for questions if you guys have questions. So just write them down or keep them in your mind. Okay, acupuncture. Who's had acupuncture? Anyone? No one. Okay. Do you know anyone who's had it? Okay. So acupuncture uses hair-thin needles. They're very tiny. They're inserted for this purpose, we're going to talk about pain. They are used widely for many things, digestive issues, hormone balancing, for fertility, like diet, all kinds of stuff. But for today, we'll talk about pain. So hair-thin needle, it is inserted into the skin or muscle, depending on the situation. When it is inserted there, it increases oxygen to that area. It also increases micronutrient flow. It releases the muscle tension in that region, and it initiates an endorphin response, which is like your happy neurochemistry, right? Puts the body into a parasympathetic state, which relaxes the body, and that all of that helps to decrease pain in that area. Sometimes I use an electroacupuncture machine, which is attached to the needles, and that stimulates the needles electrically in a rhythmic way that is kind of like using an extra strength ibuprofen, but without all the harsh side effects of using ibuprofen. And so it can be very calming to the tissue and shut that pain response down. And then I'll go into how I use these differently. But typically, somebody's going to come in for 6 treatments weekly, especially if there's like a motor vehicle accident or trauma of some kind. And then as their improvement has been sustained for a week, then they will come in every other week after that. And the idea is to get them to at least 4 weeks with no issues, 90% improvement. And then usually we kind of watch and wait to see if there's a flare. And if there's not, then specifically for crack sense, we'll close that case out. And the same goes for other things. We just don't have to worry about the case part, right? So the conditions I treat with acupuncture, where it excels over the other treatments I use, is post-concussion syndrome. Have you guys seen that at all? Yeah, I mean, this can be really debilitating for people. They can be sensitive to light, noise, headaches, all that. So needles into the scalp with acupuncture needles, it stimulates oxygen to the area that was concussed and really get rid of those issues for them quicker than other treatments and occupational therapy and stuff. It works really great with occupational therapy in addition. Disc herniation, this is where electroacupuncture works much better than any other type of treatment that I do. We can insert the needles to where that disc herniation is. We can stimulate it with electroacupuncture, and it works really well to decrease inflammation in that region and restore health to the body and get these people better without surgery, without cortisone, without pain medication. Yeah, so really difficult cases. I use acupuncture diagnostically. I was going through these slides and I was like, what's the other thing I use it for? Well, in really tough cases, if I'm the 6th doctor they've seen, which happens pretty often, then I will use the needles diagnostically, because you can, once you use a needle, you can get information from that tissue that you can't get other ways, from X-ray or an MRI, and then how that body responds tells me, okay, yeah, it's this or it's not that. You know, so I can rule things in and out without either without expensive imaging, or if other doctors are having a hard time figuring out what's going on, this helps me figure that out. And then also it's mostly covered by insurance, so we're just using the copay. The patient is going to have that endorphin release, that it's going to calm that patient down. There's a lot of benefits that we're getting while we're trying to figure out what's happening. And it's usually just a copay for their insurance, you know, or PIP covers it, which we'll get into later. Trigger point injections. I love this therapy. I went through this. I was like, I love this therapy. No, I love this therapy. I love these all. They all have their place. And trigger point injections, they're a little bit of lidocaine, a little bit of saline solution, and a little bit of dextrose. The dextrose, and sometimes homeopathic injectables, depending on the situation. The dextrose is what makes my trigger point injections different than other trigger point injections. If you've seen them before, given by MDs, they are only including lidocaine and saline solution. That is billable, but once you put dextrose in there, it's not billable, and we'll get into that later too. So I don't bill for these because, well, I will for certain things. Again, we'll get into that later. But don't expect when you see trigger point injection elsewhere besides when they're coming to see me that it has dextrose in it, because it won't. So just, you know, that's just an FYI, I guess. So trigger point injections are injected into muscle groups. It treats tension better than anything else, better than massage, better than acupuncture, better than anything you can imagine. And that I've seen. So we inject it into the tight muscle, like you know that knot, right? Yeah, she's sitting for it. And if you have a knot in your back, or you guys know, like you get neck tension, you're sitting at your computers all day long, like this will get rid of it. And that will be that. Like you'll have to have a few treatments, but you won't be chronically living with that tension. And so that's why I love it so much, because it works so well to get rid of tension. And there are no contraindications. Anybody can get it. Like there's no reason not to do it. It's not really relying on your immune system to be effective. So that's a really great part about it, is it's really versatile, and it can be really individualized for whatever the patient has going on or wherever that tension is. What else? 6 to 8 treatments, again, once a week for 4 weeks, and then every other week. And I'm trying to get them to a month long without the pain at all, or 90% improvement. I'm always going for 90% because usually that last 10% takes care of itself. The conditions I treat are whiplash, migraines, tension headaches, neck pain, low back pain, depending on where it's coming from, Achilles issues, tight calf muscles that pull on that ankle bone, or we won't get into anatomical structures, but you know where your Achilles is. If people are having issues there, loosening up the calves can make a massive difference for these people. The other really great thing about trigger point injections is that you can, and it's not then called a trigger point injection, but you can use the same solution to inject scars. And when you inject a scar, you can separate the scar tissue from the lower levels and stretch that out, making it more elastic, making it more like the tissue it was prior to that scar being there. And sometimes the tension around the scar is actually what's causing the pain and not the tension itself in the muscles. And so the other thing that this does, just also kind of as a side effect, is it softens the scar up, and the scar will become less visible over time. People really like that if their scars are in really visible areas. Okay, so now we are into Regen Med. This is really, I mean, everything I do is really regenerative to a degree, But these are the things that are most often labeled regenerative medicine because they are regenerating tissue. And these injections, prolotherapy and PRP, they rely on the body's immune system to be effective. So the person has to be relatively metabolically sound. I'll explain that in a minute in order for these to really be effective. I test people for this because I want it to work. A lot of other doctors don't. So it's just also something to be aware of if you're seeing these in your cases that you're reading through, and if the injection's not working, this could be why it's not working. Because there are other doctors that do platelet-rich plasma. I don't know too many who do prolotherapy. So the labs I run are an A1C, which is the blood sugar, a CPR or CRP quantitative, and lipid. So cholesterol, do they have diabetes? And then CRP is an inflammatory. It tells us if there's inflammation in the body everywhere, basically. Sometimes there are other ones, like if there's a thyroid problem or there's low iron. I will run those sometimes if there's a red flag that goes up and says, oh, I think this is going to stop that person from getting better. I'm going to run that too just to make sure. But those are the basic ones. Prolotherapy, exactly the same as trigger point, but the dextrose is in a high concentration. So it's just about percentage of dextrose. High dextrose concentration is stimulating to the tissue. Low dose dextrose is calming to the tissue. So with trigger points, we're trying to calm everything down, relax it, kind of like a muscle relaxer. With prolotherapy, we're stimulating that tissue to grow. So this works really great for tendinitis. It works really great for micro tearing in rotator cuffs. Works great for plantar fasciitis if it's not been going on longer than a year. Anything less than a year, prolotherapy works. It's both stimulating and calming, so it has a little bit of that calming effect, but it's going to be able to grow back cartilage and grow back tendons in a way that trigger point can't. Let's see. 2 to 4 treatments. They're spaced 1 month apart, so the person has the injection. There's a 2-week healing phase. It's an acute healing response. So if you cut your skin and you bleed and then a scab forms, and about a week later that scab falls off and you see new skin, and then that new skin a week later, it doesn't ever look like you were cut to begin with, right? So that is the acute healing response that happens inside the joint when we inject it. And that's pretty incredible stuff. I mean, I don't know anything else out there that does what this can do. And I'll talk about conventional medical model in a little bit too. But this is why I was so happy actually that Steven said, go ahead and come and do this lunch and learn, because I was telling him that a lot of people don't know about these things. And if they don't know about them, how are they going to get them? And they could choose to do something that could harm their body or put them in a pain management state for the rest of their life, or limitations, give up things that they wouldn't have had to give up if they would have known that these things exist. And so I was like, my goal this year is to just get the word out. Actually, it was my goal last year. But then COVID happened, and it's harder, right, to get in touch with a lot of people unless you're really in that virtual space. I'm more of like a one-on-one person. So let's see here. Conditions treated, sprains and strains. I didn't mention that before, but it works really well for sprains and strains. So again, injury cases, mild arthritis, mild tendon tears, and tendinitis. The body regions that are treated, any joint. So before trigger point, we're talking about muscles, right? We're injecting muscles. Now we're injecting inside joints. Head, shoulders, knees, and toes, All right, platelet plasma. What is it? It is your very own liquid gold. It does not get better than this. You are making your own medicine. All we're doing is taking it out and injecting it back into where we want it to go. And it does what Prolo does, but it's way more stimulating. There's not much of a calming effect, and we'll talk about why we need to use that sometimes too. We can do a lot with this. So it's a regular venipuncture, meaning we just draw your blood, and then we spin it in a special centrifuge, and then we take out 2 to 3 milliliters per vial. And then there's never more than 8 vials, and that's a lot. So usually I'm only using 8 vials to treat a low back because there's a lot of space there that we need to inject. Most joints take 2 to 4 vials. It's not a lot of blood that people are giving. Then we spin it down, we take it out, and we inject it. So again, it's really imperative that the person not be super diabetic or super inflamed to begin with, which you guys don't need to know that. I will know that when they come in. because they're making their own medicine. So if we take a totally inflamed person's PRP and stick it in an inflamed joint, it's not going to be a good thing. They won't come back, and I wouldn't blame them. So all this is your platelet-rich plasma and a little bit of lidocaine. Blood is kind of like, have you ever cut your finger and then it stings underneath, you know? Blood is a little bit acidic. So we put the lidocaine in there just to help that treatment kind of sink in without a lot of pain. It's more regenerative than prolotherapy. So this works to heal up labrums. So if you have a labral tear, meaning, so we have labrums, they're like a joint capsule in your shoulder and then in your hip, and then the meniscus are kind of like the labrum to the knee. Meniscus is a pretty widely used term. So we can inject the PRP into those joints, and then that will regenerate these tissues. Prolotherapy can't do that. Prolotherapy does more like that short-term tendinitis stuff. PRP does much more deeper regenerative treatment, kind of like stem cell therapy. It's not quite stem cell, but it initiates the stem cells in that region to start proliferating and growing. So it restores cartilage. This works really well with even severe arthritis. This is just a couple pictures of kind of how we do it. So regular blood, we take, this is the PRP right here, just this little bit, put it in the syringe, inject it to the joint. I talked to you guys about this already. Oh, sciatica. Okay, sciatica is a big one. It hurts. Sciatica is one of the biggest nerves in your body. I mean, it's like the thumb. It's like the size of a thumb. I mean, when that nerve is pissed, like it's really painful. So this can happen for a lot of reasons, and most often than not, it's instability in the low back. People call it piriformis syndrome. Well, that's a muscle tightening up. Why is the muscle tightening up? Well, because the joint's unstable. Tight muscles stabilize weak joints. So if you can go in and stabilize the joint, then the muscles won't tighten up. And there is reasons for muscle tension that do not involve joint instability, but sciatica most often is because of that. So if you can, well, you can go in. This is the low back. You can go in and restabilize this. So look at all that. That's all ligaments and tendons, and they're everywhere. And so you can inject, you know, I go in and I inject these facets. I inject this iliolumbar ligament, and then the sacroiliac joint, you know, which is here. So that's pelvic instability, which can happen, you know, anytime like someone is in a car accident. And I'm just kind of talking about car accidents because that is a lot of what you guys do. So they're gonna see the person about to hit him, and then they're gonna put the foot on the brake, or they're gonna jam their feet into the floorboard, and that can create this problem. Because you then stretch all of this, and then it reverberates, kind of like whiplash, but in the low back. Okay, conventional treatment. These patients get prescriptions. They get over-the-counter medication. They get cortisone injections or surgery sometimes. So chronic use of pain management medication damages the kidney, the liver, and less talked about is that the digestive system, which then causes low micronutrient absorption, which the patient needs in order to heal. So all of these things, they have their place, but not chronically, like not forever. And because then that patient gets into that pain pattern where it just never gets better. And not only that, but then it's going to cause chronic health problems later. So their quality of life is going downhill because they're going to use this and no one's telling them not to. Cortisone injections, there are a few times where cortisone is a good idea. Very few, but there is. Most of the time, it's just gonna, you know, the cortisone that's prescribed for dermatologists, and they're like, don't use it. Here it is, but don't use it. You know, like that's pretty much what they tell you. And that's because it thins the skin. It does the same thing in the joint. So people who are getting repetitive cortisone injections, it's thinning the tissue. It is turning off the pain, but you may as well turn off the fire alarm in a burning house. The house is still burning down, right? But you just don't hear it. And so that's why that's kind of just, they actually, orthopedists in the last, I don't know, probably 5 years, I feel like are using them a little bit more conservatively because we know this now. And if you have to go and repair a joint that's been chronically injected with cortisone, like that's not a joint that's going to heal very well because the immune response is no longer happening in there. Prolotherapy and PRP stimulate the immune response, not shut it off. So that's a difference. Surgery can be great when it's indicated, but it will leave the patient with some limitations unless they're super fit, so, or willing to do the work to get out of that. And even then, sometimes there's limitations. Total tendon rupture is a surgical referral. Otherwise, PRP or PROLO can help. So if it's like a totally torn ligament, then, I mean, just call the orthopedist and get them in. PT is awesome, but also like, they're like, oh, here, go to PT, and then that's all, you know. PT works excellent if it's a good physical therapist, and if it's used in conjunction with these other therapies. Chiropractic, massage, acupuncture, prolotherapy, trigger point, you know, with all this stuff, the patients who take advantage of all these treatments together do incredible. I mean, really get better, and then they're done and that's it. There's no more, you know, living on pain medication or saying, okay, case closed, you got 50% better, have a nice life. You know, that doesn't happen. Just a plug for another BNI person is Christy Riley. She is incredible. If you guys don't know her, she's in Burien.
Physical therapist?
Yeah, Kintsugi.
Physical therapy.
Okay, are you in the Burien chapter?
Yeah.
Okay, yeah, she is awesome. So just gonna side plug her. Okay, so payment. So Stephen really wanted me to go over this because how do you guys know if it's a good fit financially and that sort of thing? PIP covers everything. They don't ask questions, they just cover it, whatever the patient needs. So that's a really good place to start if the patient has PIP. LNI doesn't pay for anything in contrast. It's terrible. It's just the way it is. They don't pay for acupuncture even, which is just crazy to me, but they don't. Regular health insurance will pay for the initial workup, the naturopathic workup, and the which is me just assessing like what does this patient need, and they pay for acupuncture also. I'm in network with Regents and Primera. Crystal, if any of you guys have called my office to get records or whatever, Crystal's my office manager. She was at one of the beginning of these slides. She's awesome. She checks patients' insurance. She does a great job. We hate financial surprises. Our patients hate financial surprises. So it's really important to us that we know and we can quote people correctly before they come in for treatment. And so if you're not sure, just say, hey, maybe this would be a good place for you. Check it out. Call her. See, what kind of coverage you have. A lot of people have out-of-network benefits, so we help them get reimbursed by their insurance company to pay for things. Trigger point injections, prolotherapy, and PRP are not covered by health insurance, at least not yet. I mean, I think they probably will be. A lot of orthopedists are doing some of these things too. Yeah, I think that's all of that. These are billed charges and time of service charges. So if the patient pays at the time of service, they get a reduced amount, right? Because do you guys know how to bill? Do you guys know about insurance? It's like you got to bill something and then they reduce your costs and they tell you what they're going to pay you. Mm-hmm. And so it's kind of like this really silly game that we've developed in the United States and maybe other places, but that's why the billed charges are higher. And then that's what the actual costs are. The injection therapy, it just is what it is. It just keeps things easy for me. I've also put together cash incentives for people, so they're not one-shot wonders. You know, as incredible and magical as I feel they are, you need more than one to really get the full benefit and the full improvement. To grow a labrum back, I mean, we're doing like a mini surgery multiple times, and so it takes time for that to grow. And so for people who want to do that, they're like, yeah, sign me up, I'm doing this whole thing. I give them discounts for that because I want them to get better. It's really important to me that people, and that's why I also test them metabolically, all those labs that I do, because I know that if their immune system's not working, that's not going to work. But the great thing is that trigger point and acupuncture will get them a lot of the way there. If they are diabetic or they do have comorbidities or they're sick, basically, then acupuncture and trigger point are still really, really great options for those people, and they still will help them. Okay, I don't do third-party claims or I don't hold them. PRP takes like 50 minutes. to draw the blood, spin it. And so that, you know, I would have to see insane amounts of volume in order to be able to hold claims for, I used to do this, but it really screwed up my book, so I don't anymore. But we offer the cash discounts, and in a lot of cases, if the patient really can't pay for the treatment, then we will work out a payment plan, which we do before we start the protocol. And so we talk about it, we agree upon it, and then we move forward with that payment plan. Then so if they pay for their treatment out of pocket, they submit it to you guys or to their lawyer. And when the claim closes, they get reimbursed, and we've had really good feedback about that. We've done that quite a few times, and people get paid. I have a YouTube channel, so if you guys are interested in that, I put out weekly videos. I have a little pad right there if you want to put your email address on it. We'll send that out, or you can just subscribe to my channel. I talk a lot more about many things, mostly related to pain, but hormone balancing, food allergies, and food sensitivities, lots of other stuff that's related to systemic pain that I'm not talking about today because it's not really related to why we're here. All right, that's it. Do you guys have questions about anything? Yeah.
So for the PRP, you said that it like restores cartilage. So like in cases of like people who have been in car accidents, like I have, for example, like I have a client who has no cartilage in like his neck area.
Mm-hmm.
So like would that help with that? Like would the PRP help with that, with like restoring cartilage?
It would, and that's a good question, and I meant to bring this up and I forgot, so I'm glad you asked. I do not inject prolotherapy or PRP into necks.
Okay.
I believe that needs to be done with an ultrasound. I don't use ultrasound. I've been looking for somebody who does that, and I haven't found anyone, but I can use a different technique. It's not a procedure I talked about here. It would have just become too lengthy. It's kind of a not well-known thing. It's perineural prolo. So a combination of treatment of electroacupuncture, perineural prolo, and trigger point injections would help that patient.
Okay. Even if it's been like a long-term thing?
Mm-hmm.
Okay, so it doesn't matter the amount of time that they've been in pain?
It will, yeah, so.
Or it just depends on like case-to-case basis, obviously.
Yes,
Yeah.
you can't expect to run 10 miles into a forest and 5 miles out, right?
Yeah.
So if it's been going on a long time, it's gonna take a lot longer to get better.
Yeah.
It just is, yeah. But there's usually something that can be done. So like, let's say, you know, they have no other options right now.
Yeah.
Then it's better to do one of these things or some of these things to get them 50% better at least,
Instead
right?
of not better at all.
Exactly.
Yeah. Okay.
Yeah, there's
Thank you.
always something that can be done.
Okay.
Well, I have a question. You said they can't be inflamed,
Mhm.
but like I have a client that has like 5 disc rupture and a bruised spine, and he's having a very hard time.
Mhm.
Nothing's helping, but he's inflamed, I would say, because, so what would the
Yeah, good question. That's acute inflammation. I mean, it's technically chronic inflammation, but not metabolic inflammation. So there are different types of inflammation. And when someone has high insulin levels or is type 2 diabetic, they are going to have a suppressed immune response. Their immune system is not going to be functioning as good as it could be. It's not the same as an injury trauma, inflammation that's localized to that area. The metabolically unsound person is going to have like circulating lowered immune response. And when we inject Prolo or PRP, we are initiating an immune response. So we need the immune system to be like ready to go. So what we'd be doing with that patient is calming down the localized chronic inflammatory thing that's going on. But it doesn't mean that their immune system isn't functioning, right? Does that kind of make sense? Okay.
Is there a limit to prolotherapy injections to a single area in a lifetime?
No.
Because there isn't there, for the regular doctors?
For cortisone.
Yeah, you're only supposed to have like 5 a year, 3
Yeah.
a year, and they keep giving you like 8 a year or whatever.
Yeah, because it thins the tissue and it's like, it's just melting in
And then
there.
it causes like bumps and stuff, doesn't it? Like lumps in your, like if you get it, I've heard it's caused like lumps if you have too much of that in your system, like steroid or whatever.
It could, yeah, it could cause some cysts to form in there, yeah.
I have a couple questions. The
Sure.
first, with trigger point injections on there, you said it lasts. So after you've had, like, say you have your like, first set of treatments, you know, generally, like, how long does it take? Like, say they have like another flare up or something where they have to go again. I mean, does that happen, or do they just never go again?
Yeah, no, that's a good question too. So once someone doesn't have pain from that trigger point for over a month, they typically don't need to come back unless they re-injure it or they come in for a different reason.
Right.
My whole mission in my practice is to treat people and get them done with that thing. And then if they, because I hate, just me personally, like I get bored with things where I'm like, oh, you're back for the same thing 3 years, you know, that I'm not doing my job. So trigger point really helps sustain release of those muscles long term, especially if it's from a trauma. There's one person that had a lot of injuries from falling off a horse, and she had to come in probably, it was like 20 or 30 times over the course of a year. But I mean, her issues were chronic, and you know, and so it just depends. Like that's a severe case. Most cases aren't like that.
So what if it's like, you know, us where we're sitting at a desk and it's like, you know, the neck pain or shoulders? I mean, after, say we go get that treatment, but we're still, this is our job, we do it every day. I mean, most likely will we have to come back after a while.
Yeah, so you need an ergonomic assessment of your workstation, and you need to go see Christy Riley, and you need to come get some trigger point injections. And once you have that, all those tools, then it won't come back. Right?
Gotcha.
So you have to, it's a holistic approach. It's a 30,000 foot view. Yeah, that's your job, but like either you have anterior head carriage when you're sitting there, right? So it's about talking about how do you sit up, have good posture, is your mouse in the right place? You have to kind of assess like what's the obstacle to cure? Like what's stopping your body from getting better? What's creating that chronic response? Yeah. Did you have another one? Oh.
So I have a client that has had like 6 or 7 injections. He's 50% better. The doctor has recommended spinal fusion surgery. He doesn't want to get it because he's too young. He's 50. So what would you recommend for that? But he only has health insurance is the problem.
6 to 7 cortisone injections to his back. Yeah. So
I think it might have been his shoulder. I can't remember.
Okay, it doesn't matter. I'm just trying to get a feel for the case. So anytime someone's had cortisone injected, I have to wait at least 8 weeks before I can put prolonged PRP in there. And the more cortisone they have, the more of a toss-up it is of whether or not it's really going to work. Again, still better than doing nothing. He would have to pay out of pocket for the injection therapy because he doesn't have PIP, right? And then again, we can talk about payment plans. I don't know if I answered that. Oh, spinal fusion. Yeah, I definitely think there is a lot that can be done for that patient. You know what? And that's one of those complex cases where I may be using a combination of treatments to get that person better. You know, I may we could start with electroacupuncture because that's micro regenerative. It's a very gentle anytime you put a needle in someone, it starts that acute healing phase, so it's going to regenerate something in there, right? So I can use the electroacupuncture machine to create kind of a prolotherapy effect that would be covered by insurance. And sometimes patients like that respond so fast, and like it's like such a simple. It blows my mind every time because I'm like, man, you've been through the ringer. And we do a few acupuncture treatments and they're like, I feel amazing, you know, and you're like, okay, great, see you later, you know. So I would just refer them in.
So I have 2 questions. One, does somebody need like a doctor's note to go to you?
Most of the time, no.
Okay.
Yeah, they can just decide to come.
Okay, and then let's say like a client, like I have clients who do physical therapy, chiropractic, massage, all that. So like, let's say I was doing physical therapy, but I was kind of over it and they're saying there's nothing more that they can do for me. If I went to you, would I still need to be going and doing physical therapy, or can I just go to you to like get that done? Or would it be like, I know it's case-to-case basis, but like if somebody has like already exhausted the amount of times that they can go to PT, like what would you recommend for that?
It would still be beneficial because they can, most of the time people have at-home PT
exercises.
Yeah. So they still would need to do those, but they don't have to continue going to PT.
Okay. Yeah. And then, sorry, I have one.
No, that's okay. You don't have to apologize. But I will rely on you because I'm not looking to at a clock. So you'll have to tell me when.
Oh, we had an hour, so it's still 35.
Okay. So for the trigger point injections, you were talking about dextrose, and that some people don't use it. So why do you choose to use it, and like what is it?
Yeah, dextrose is just it's a sugar molecule.
Oh, okay, I see.
And I use it because it's the active ingredient.
Oh, okay.
So it is the thing that is calming to that tissue.
Okay.
When you're using lidocaine and saline, you're just injecting a bolus of something into the trigger point, and hoping that that's enough for that to work for that patient. And sometimes it does, but a lot of, it's for me, if I see, okay, well, 50% of people are responding to this and 50% aren't, that's not a great success rate for me. So when you add dextrose, you can get 90%, even though 90% of patients will respond to that. So dextrose makes it a more effective treatment.
Okay.
So I could have chosen to stop using that and build for it, but I don't feel like, to me, that's not the right thing.
Yeah.
Whether they cover it or not.
Yeah. As long as you're helping 90% of the people instead of 50. Yes.
Exactly. Yeah.
Now this caught my eye because I suffer from migraines, so I saw for the trigger point injections, it can help with migraines. And now I've done so many options for it and nothing helps. So like, where do you inject it, and like how can it help with migraines?
Okay, so migraines, if they are not related to whiplash or trauma, are typically an internal job and an external job. So there is either a hormonal imbalance, there's food allergies and food sensitivities that's causing tension to the region. So assessing those and getting, it's the obstacle to cure thing again, right? So if you, and I go through a whole, for every patient that comes in, whether they're PIP or Clarkson or whatever it is, like I go through my same process. It's a very systematic process. And I will, even those patients that come in for car accidents, I'll say, hey, this may be something you want to assess. We might not get you all the way better because you have had these prior to the car accident, right? The migraines or whatever they are. And like, you may want to do this on your own separate from this thing in order to, get full benefit. I'm never withholding that information.
Right.
But at the same time, that would be where you would want to start. And then the trigger points are injected to the neck directly, to the paraspinal muscles along the cervical spine, and then traps and rhomboids as well. Because a lot of times, these are your rhomboids. So a lot of times there's referral trigger point. Trigger point means a muscle, when you press on it, it radiates, shoots pain somewhere else. So a lot of these are causing migraines a lot of the time. Sometimes it's related to PT because, again, you're like this, so they're always being stretched out, right? And the pecs are always being contracted. So you have to open the chest and learn to contract these to have good posture. So a holistic approach again, not to overcomplicate things, but, and I'm not necessarily explaining all this all the time to the patient because it can be overwhelming, but it's like, these are things you need to do to get this gone. Does that make sense?
Yeah, it does.
Okay.
So I have a client that was trauma, and it was like a head hitting back of a wire, so it wasn't a car accident, but it was the whiplash effect.
Yeah.
But it's been a year, she hasn't had any relief at all, and so I'm wondering, her symptoms are she has heaviness of the head that is not stopped at all, and then she's got, her nervous system is on full like fight or flight, and they haven't been able to figure out why. So she's unable to sleep at night, goes days without sleeping, and in 2 years she's had, just recently she went on a retreat and she had 5 days of able to sleep and relief. So what can you do for her?
Yeah, so what happened?
She just was at a tree farm and she hit a wire, there was a wire there, snapped her head back. She didn't fall or anything, but
Was it traumatizing for her?
Oh yeah.
Like emotionally?
Yeah, everything.
So there's something with acupuncture called an aggressive energy treatment, and it's more the emotional, like psycho-emotional component of healing, which again, I didn't talk about a lot here, but that is part of all this. And it's like a still point for the body, so it grounds the body. And so anyone who is having trouble healing because their emotional system is scattered like that, like their cortisol and adrenaline is just constantly ramping, that treatment, done a few times, will then allow the other treatments to start working.
So is that covered by health insurance?
Yep.
So we're gonna do that. Okay. So what's the formal name of that again? So when I refer her, I can.
Just call it the AE treatment. It's aggressive energy. I don't even think all acupuncturists do that. So yeah. But I'll know what it is if she just says AE or she says she's a referral from here, and like they all fill out questionnaires before they come, and they'll, in their little chief complaint, usually I'll, like if you refer her and I read that, I'll know who it is. You guys had a lot of questions. Good job. Yeah.
Your presentation was very informative.
Yes. I'm happy.
And we're all case managers here, so we all deal with the treating clients and as they're getting done with their treatment. So we hear a lot about pain and different things and their suffering, so it's.
Mini social workers.
Yeah.
That's a thankless job
Different
sometimes.
information, because it's like, for me especially, like I'm working with your office right now on a couple of my clients, so it's nice to know that these are the things that you're actually doing for them.
Mhm.
And some of my other clients might benefit from that who
Oh,
live
yeah.
in the area as well.
I'm thinking of
so-
like 6 right now.
Yeah, exactly.
Oh, I'm so happy to hear that. I really am. And that's, I think, why Stephen mentioned that I should just come and talk directly to you after I did a one-to-one. Yeah, I really appreciate it, guys.
Well, thank you
Well,
for
thank you.
coming.
Yeah, of course.
Thank you for coming, and I think we're all set. Thank you.
And
Yay.
we're done.
Okay, I already started watching.